Essential oils have so many different uses, but when it comes to bacterial infections, there is only a handful of them that are very powerful in reducing symptoms. Eucalyptus Essential Oil. Eucalyptus essential oil is a natural disinfectant and works as a natural germ killer when diffused in your house. This essential oil also helps reduce symptoms of asthma attacks, chest congestion, and acts as a body coolant. Ginger oil. Besides reducing nausea and upset stomach symptoms, treating heat strokes and inflammation, ginger oil is also used as an antiseptic and antibacterial agent. Diffusing ginger oil in your home can help kill germs and bacteria quickly. Grapefruit Essential Oil. Known as an antibacterial essential oil, grapefruit oil is very effective in killing bacterial and fungal infections. You can also use grapefruit oil to treat stress, muscle pain, treat psoriasis and headaches. Tea Tree Essential Oil. Apart from treating skin infections such as stings, boils, vaginal infections, toothaches, and burns, tea tree oil also has the power to kill bacteria and fungal infections fast. Tea tree oil can cause a burning sensation when applied directly to the skin, so make sure you dilute it with water or coconut oil before applying it. Oregano Essential Oil. Oregano essential oil contains thymol and carvacrol, which are both known to fight off bacterial and fungal infections. Another important health benefit of oregano oil is the power it has to treat gastric ulcers and inflammation. Thyme Essential Oil. Apart from treating conditions like diarrhea, sore throat, colic, and cough, thyme essential oil contains a compound called thymol which helps destroy bacteria. Studies show that thyme essential oil strongly inhibited the growth of the clinical strains of bacteria tested on a group of people. Cinnamon Essential Oil. Apart from helping to kill lice, insects, and making your home smell heavenly, cinnamon essential oil has a ton of other health benefits as well. This study shows that cinnamon essential oil can help break up the protective layer which forms over Pseudomonas aeruginosa infections. P. aeruginosa is a common cause of bacterial infection in immune-compromised patients.